Good morning. My name is Tracy Trypuc. Welcome to Your Health Matters. Before I introduce my guest, I would like to share some information. Today we will be discussing measles and what you can do to make sure your family is protected. Many people today do not remember what measles is and the harm it can cause to those infected. The measles vaccination program began in 1963. Prior to that program, the CDC estimates that about 3 to 4 million people became infected with the measles each year in the United States. Of those, 400 to 500 died, 48,000 were hospitalized, and 4,000 developed encephalitis, which is brain swelling, from measles. As of January 2015, 102 people from 14 states were reported to have measles, and those numbers have increased to 121 in 17 states. And now I would like to welcome my guest. Today I have with me Patricia Facquet. She is a PhD candidate. She has a Master's of Science in Public Health. She is a CCRC, which is a Clinical Trials Research Coordinator, and a registered nurse from Adelphi University College of Nursing and Public Health, who is an expert in communicable diseases. Patricia, welcome.
Thank you for having me.
I thank you for being here today. As a professor of the many courses you teach, you are the course coordinator for community health nursing. Could you please explain some of the courses that you do teach within that community health nursing and how that has, been able to help you in your career to be able to discuss and become an expert in communicable diseases?
Community health nursing is just one of the courses that the traditional undergraduate students take, as well as our RN to BS in nursing students take. It gives them an idea of what is actually outside of the acute care setting. And in this case, they're being educated more intensely on measles itself. The CDC says that we need to think measles. So we have a 15-minute debriefing at the beginning of each of our lectures. We're having 6 sections of community health nursing right now, so that our students could actually go into the clinical setting, and there are many clinics, and be able to assess the children and the adults properly if they indeed have the measles.
Okay. So let's briefly discuss the history then of measles. After the highly effective vaccine program, measles was eliminated in 2000. Unfortunately, many people have forgotten what this disease can do. So tell our viewers, what is measles?
Measles is a highly contagious respiratory virus. It's the most contagious virus in the respiratory system. It can cause runny nose, conjunctivitis, which your viewers may think of as pink eye. It can also cause a very, very high fever. And then 4 days before the rash appears is when the child or the adult would be contagious, so they could spread that virus to other people who are not immunized.
And it can then look like other respiratory illnesses.
At the beginning, it could even look like a general cough or cold. It's taken a while to dissipate. It could also look like an upper respiratory infection. So the CDC has started a campaign, Think Measles. A lot of physicians, nurse practitioners, and PAs are younger than those of us who've experienced measles in our career or our childhood. So they're not accustomed to thinking of measles because it was eliminated in 2000, like you said. And unfortunately, it's climbing back up again.
Yes. So if you could tell our viewers how it is not just spread here, but how it's actually been brought into the country, either from travel or from people that visit our country.
Measles is spread primarily from people who have the disease, and the virus itself can stay alive in the air. It's called droplet or airborne virus. And then as we speak, cough, breathe, that virus is emitted, if we have it, through the air, and someone who's not immunized walks through, breathes, touches their nose, their eyes, or even touches an object that the virus can stay live on for at least 2 hours. The problem that we're having now is that quite a number of countries are having larger outbreaks of measles than we are, especially the Philippines, parts of Europe. So when people travel to those areas, or we have visitors coming back to the United States, they could easily spread the measles. And unfortunately, it's affecting the children who aren't really able to get the vaccine yet.
Okay. And we'll touch upon that in a moment. Okay, so exemption rules or opt-out rules. They vary from state to state because it is under the purview of the individual states. And so California, not to pick on California, but they're just one of the states that allows for a religious or philosophical exemption. Mississippi allows the parent to opt out only for medical reasons, no other exceptions. Every state also allows for medical reasons. Here in New York, an additional exemption is made for religious reasons. People ask, well, how does this affect me if their child is getting vaccinated, but there are other children who are not getting vaccinated? Now, if before I actually let you start answering this question, if you could address, number one, some of the reasons why a child might need a medical exception for not getting the vaccine. But there are communities that are not vaccinated, either because of philosophical reasons or for religious reasons, and then you have the medical reason. And so then people who travel into these communities then can spread the infection. So, and then we'll talk a little bit more about herd immunity after this. So. Okay.
A child who is restricted for medical reasons could be because they had a reaction to another vaccine. Very, very uncommon, but it does occur. It could be a child that's what we call immunocompromised. Their immune system is decreased. Unfortunately, they might be on chemotherapy. Two actual stories that have been in the news recently have been from families whose children have leukemia, and they're asking the school systems to actually prohibit children who aren't vaccinated coming in because their children are unable to attend school right now because their immune systems are so low. And then we have a group that, like you said, their parents opt out, but usually it's more for medical considerations of previous history with a problem with the vaccine, and then immunocompromised or poor immune system. Or the other thing too is youngsters under the age of 12 months.
Okay. Or they're also requesting that they be spaced out. That they start later and then they be spaced out more.
Well, you have to remember too that if a child's born prematurely, theirs are routinely spaced out because they're tinier than their full-term newborn cohorts. And you also have parents who don't want measles, mumps, rubella given all together as an MMR, so they do space them out. And if the health provider works with them, they can still ensure coverage.
Right. Okay. So that being said, this is from a new CDC report. To maintain herd immunity, communities have to vaccinate enough residents to protect the small number of people who cannot receive a vaccination for medical reasons. For example, medical experts say that 95% of children should receive 2 doses of measles, mumps, and rubella, the MMR vaccine, to maintain herd immunity against measles. So could you explain how falling below herd immunity level places a community at risk?
It's not just children that have to have that 95%, it's the entire population. So if 95% of our population has been immunized, then when the virus is in the air and someone who has not been immunized is surrounded, unknowingly in some cases, by the rest of us who are, then the virus has nowhere to go. So us being immunized at that 95% actually gives roadblocks to the virus, so then it disappears. What's happened now is we've gone below that 95%, and the people who've opted out of receiving the vaccination are actually becoming susceptible because we don't have that number. And it's equated to surrounding as a herd of cattle, sheep, an old term.
Yeah.
But it's very effective.
So there have been some reports of doctors in the news recently in efforts to trying to protect their patients who are immunized, of no longer accepting or turning away their patients who are not vaccinated. And you and I had discussed this, and there are some ethical concerns as well as missed educational opportunities in doing so. Would you like to elaborate on this for our viewers?
Well, I think that we have to look at the reasons why a healthcare provider is limiting access to patients who aren't abiding by the immunization policy, but we do need to have more education. Maybe it's lack of knowledge on the parent or caregiver's part in the understanding. We did have false information put out about 10, 12 years ago, and Autism Speaks is now even coming out with a statement saying that children should be vaccinated. There's really no link between autism and the measles, mumps, rubella vaccine, and we have to get that word out even more. Of course, a health provider can decide what he or she wants to do. We've had this discussion in our ethics classes, but again, it's more of a missed opportunity for education, which is why your show is so important, us making sure that our students and our health practitioners understand so that we don't have those missed opportunities anymore.
Well, I know it's been a while, but when my son was little, he's in his 30s now, but when he was young, the pediatrician had a sick waiting area and, a not sick, a healthy.
Too. Yeah.
So, I mean, that was one of the things I was thinking about is, if the healthcare provider wants to, separate because he feels that there is a potential for infection, that there's some way he can continue or she can continue to see their patients without having to turn them away.
If you don't mind me sharing my personal story, I've had all three, measles, mumps, rubella, and chickenpox in the second grade. And my mom called our pediatrician and he said, come right away, but use the back stairs. And he did have a sick waiting room. And I think that as health providers, we do need to possibly go back to that so that we can isolate those who may be infected with measles from the rest in the well child waiting room. That way you don't have to miss that opportunity of treating your patients and educating more to the parents.
I think that's a good idea. So, as you just alluded to, can we try with science to dispel the vaccine link to autism? And you did just mention that, but in specific regard to the 1998 paper by Andrew Wakefield, which has since been retracted after the Institute of Medicine did a thorough review of more than 1,000 published research studies in August of 2011. And they concluded that vaccines are largely safe and do not cause autism or diabetes. And I understand that parents, when they especially have a new child, they're nervous, they're afraid, and sometimes when they have this information that may be old and then other people attach things to it, and it's hard for them to understand that it wasn't done correctly, even after it's been retracted. So is there some way to try to get that information or that new education out to the parents? Because I hear some things, and it's still like they believe that paper is still an accurate piece of research.
I think as health providers that we need to make sure that our parents know. The study that was done only looked at 12 children. And out of those 12 children, some of them did not have autism as a diagnosis at all. The statistics were falsified. Whenever we do those type of clinical trials, we also have to be able to replicate it or repeat it with another group of investigators. And in this case, it could not be repeated. And it took quite a while to actually debunk or reject the study. And right now, we're still trying to get the word out, and it's been 12 years later. It's very difficult because at first you can feel empathy for the parents trying to find what the cause was, and the fear of parents that don't have a child with autism but do know that that message was out there. So I think more patient education, explaining how the study was conducted improperly, and then going back to see the authors of the study and how they took their names away from it because it was falsified.
Yes. So people are asking, you know, who is at risk and who is not at risk. I can quickly say that people who are not at risk are those that have received 2 doses of the measles, mumps, rubella, were born prior to January 1st of 1957, or who have a blood test confirming immunity, which can be expensive to get, but you can get it that way, or who have a history of laboratory confirmed measles. I think it's very important to note that parents keep all of their child's immunization records to give to their children when they go off to college.
Yeah, everyone should have a copy of their own as well as their parents'.
But I think
Definitely.
that there are people that are now concerned who is at risk. I mean, if you had your MMR, do you need a booster shot? So could you?
Well, there's a group of adults that a lot of people are forgetting about because we just heard about the outbreaks in children. But if we go back to what happened at the amusement park in California, quite a number of adults contracted measles. And so we're looking at people who were immunized with one MMR, measles, mumps, rubella, before 1985 that didn't get a second booster because the concentration was more on school age and those going to college. So if one of your viewers has only had one measles, mumps, rubella, they need to go back for another, and that can easily be determined by immunity through a blood test. Also, if children are going to be traveling overseas, and we know that that's an area of measles outbreak, they are giving the measles vaccine to children as young as the age of 6 months, just for international travel.
That's very good to know. So then what would be your advice for parents who are still unsure about what to do? The people that are leaning, and I mean, those that have made up their minds seem to, you know, you can still try and educate, but then you have those that just don't know. Should they sit down with their pediatrician and talk, you know, and write down all of their questions?
I think that there has to be an open conversation. A lot of school systems, school nurses, your show, public health departments, even Senator Schumer has actually brought in that he wants to make sure that measles vaccine and all of MMR is available to the public. I do think that the organization Autism Speaks actually coming out and saying that children should be vaccinated is a huge step forward. And you just can't believe everything on the internet.
That's very true.
So I think that if you're unsure of it, you should contact your health provider and see if he or she can add more to the conversation. But I don't think you should just believe everything that's out there. You need to ask questions. Be an advocate for your child, but also be an advocate for your community.
Yes, very true. So then going forward, what do you see as a need for continuing research, awareness about vaccine safety and efficacy, and you know, because we don't want the numbers to continue to rise, and we would like to see the herd immunity to increase. So, what do you see? How can we, as public health professionals, as parents, as healthcare providers, what can we do to help try and stop this from continuing to progress?
Well, Healthy People 2020 has more of a focus now on disease prevention and health promotion. And most schools of nursing in the community health courses are focusing that way. A lot of public health and community health clinics are focusing more on health promotion. So I would think it's more of developing programs or continuing with existing programs of patient education, being able to have more one-on-one or small group discussions, focus groups. Also, there should be some more funding dedicated to research so that we can see what is safe and what is not safe. But also the FDA has an entire vaccine reportable untoward events or unusual events that health providers as well as the public can report if their child or if they themselves have had a reaction to the vaccines.
Okay.
Just want to mention, just because a vaccine or a medication has been put out for everyone's consumption doesn't mean that we don't stop studying it. We take all those side effects, adverse reactions, and we continue to make sure that those are safe for the general public.
Okay. Do you have any final thoughts, Patricia?
I thank you for the opportunity to come, and I hope that I've given your viewers some more information, that we've actually empowered them to ask questions.
Yes.
And make sure that everyone asks the questions. If you don't get the answers you want, go to someone else.
Can you give us the website at Adelphi for the nursing and public health?
We're adelphi.edu nursing, or sometimes it's nursing.adelphi.edu. So it just depends on how the website comes up.
Okay.
Yeah.
All right. Well, I would like to thank my guest, Patricia Facquet, a PhD candidate. She is a Master's of Science in Public Health, a CRCC, a Clinical Trials Research Coordinator, and RN from Adelphi University College of Nursing and Public Health. Thank you so much for being here today.
Thank you for having me.
Okay. Please tune in next week for another Your Health Matters with Tracy Trypuc. Please have a healthy and safe day.